My name is Paul Wischmeyer, and I am a professor of anesthesiology and surgery at the Duke University School of Medicine. And I work here as the Associate Vice Chair of Clinical Research for anesthesiology. I'm the director of the nutrition therapy team and the parental nutrition team here at Duke for the hospital. And I'm the director and founder of the Duke Clinical Nutrition Online Fellowship, a fellowship we use to train physicians and other providers all over the world in clinical nutrition. To get to the question of where we stand right now with the role that nutrition plays in preparation and recovery it's a role that's far underutilized. And I think the critical reason for that is physicians are not taught nutrition in medical school. 75% of our medical schools have no clinical nutrition training required at all. And so our physicians and our healthcare providers aren't taught the critical role of nutrition in the preparation and recovery and health in general of their patients. And when you survey new physicians, somewhere between 10 and 15% of them is all will say they have any ability to discuss nutrition with their patients. So that means about 90% of our physicians feel no confidence in their ability to talk about nutrition with their patients, much less give them the best routes by which they can optimize their nutrition care or even take basic nutrition care of themselves when they're not sick, much less when they are. And so I think we have an enormous deficit in nutrition teaching and knowledge in our physicians that exist, but that creates an enormous opportunity because the research is robust for the incredible benefit and role nutrition can play in recovery and in preparation for illness and surgery. And so I think it provides a unique opportunity for a very low cost, very safe intervention that we can teach our physician colleagues and teach our healthcare provider colleagues to employ, and is not being utilized almost at all now. And so I think it creates a huge opportunity, especially for unique products like what Men makes, to really now have a high quality product that is evidence-based, science-based, and has extensive clinical research trials behind it to give physicians the tools to meet the nutrition needs of our patients who are preparing and recovering from surgery and other illness. The populations we're seeing now clearly are changing in the people we see coming to surgery. So the population of patients coming to surgery is clearly a different population in the last 10 or so years, especially the last 5 or so years, where now I would say a majority of the patients coming for major operative procedures are obese, and many of them, perhaps even a majority at times, also have significant coexisting medical conditions or complicating medical conditions like diabetes, like other metabolic diseases. The obesity plus the diabetic patient is a particular challenge. And then those patients, although they look well-nourished because they're perhaps overweight, or people would say, well, they've had too many calories they've been taking in, the challenge is the important parts of their body mass that helps people really recover and prepare for surgery is their muscle mass. And so while they may look well-nourished, they are actually, by definition, malnourished because their muscle mass is very low and the patients are sarcopenic. And so, we classically know who the malnourished patients are, the very thin, cachectic-looking, wasted patient who's lost a lot of weight. Those patients we know perhaps we need to intervene with nutrition on. But I would say probably more than half to 2/3 of the patients coming for major operations are obese patients who are actually probably just as much at risk because they have the same low muscle mass and sarcopenia problems that our very thin patients have. They're obviously malnourished. And again, your muscle mass is your body's metabolic reserve, kind of your armor that you have that allows you to recover and sustain yourself when you undergo a major injury like a surgery. And that's true whether, a tiger bites you, a car hits you, or the surgeon hits you. Your body has really one way to respond to that, and that is by breaking down muscle to mobilize amino acids and glucose to run away from the tiger or run away from the surgeon and fuel your immune system to prevent infection and to allow you to recover not just health-wise, but functional-wise, so that you can walk down the street again with the people you love and hold your children and grandchildren again. All that is really dependent on the amount of muscle that you enter a surgical event with. And our obese patients, we believe, and our data would show, are just as challenged as our thin patients, perhaps even more in some cases, because of the other concomitant illnesses like diabetes they often have, which creates other organ dysfunction, say in the kidneys or in the blood vessels or in other areas. And so our populations have changed. And I feel like the majority of patients coming for surgery are at very high nutrition risk and would benefit enormously from very straightforward nutrition optimizations like the new interventions that I was honored to work with you at Mend together to build using the science that exists. I think it's exciting to say that there is a robust amount, a large amount of evidence for the role of nutrition in preparing patients for surgery and other illnesses, but in particular surgical interventions. And I think this goes back now many years and many thousands of patients studied. We have large meta-analyses showing the benefit of nutrition on surgical interventions. And I think a few key facts from the evidence are really important for anyone who cares for surgical patients to know. And the first is, for instance, 2 out of every 3 patients coming for colorectal or major GI surgery are malnourished. And so we already have robust evidence that in some of our most common surgical types, like GI and abdominal surgery, there is an enormous number of people, 2 out of every 3 already are malnourished. And that probably doesn't include the obese patients with low muscle mass who are also malnourished. And so a majority of our patients are coming not at all ready for surgery. And the most important thing that predicts is we know that patients who have surgical interventions who are malnourished will die 5 times more often than patients who are well-nourished who have had their nutrition addressed. Again, you're 5 times more likely to die from an operation if you have that operation and you haven't had your nutrition needs addressed. And you're 3 times more likely to have a complication. And I always say to both my patients and my surgical colleagues, I think if more of our patients knew that, none of them would want to go to surgery without having their nutrition optimized. And I don't know any surgeon who'd want to operate on someone with a 5-fold increased risk of dying when the thing that they're having that risk from could be treated in 1 to 2 weeks in many cases, and we could significantly modify and reduce that risk with just a few weeks of intervention. And when we survey surgeons, they all tell us that more than 80% of them tell us they believe clearly nutrition would clearly improve the outcomes of their patients if it could be optimized for all of their patients. But when we survey the large, say, cancer and GI surgery fellowship training programs, the big academic centers in the U.S. that are supposed to be the best at the forefront of practice, only 1 out of 5 of those major universities even have any nutrition screening programs at all for their patients coming for these major operations with this major risk if nutrition treatment isn't given and if malnutrition isn't treated. So even though the surgeons believe it, no one's seeing it. And what is even more amazing perhaps is they could save a lot of money if they did it. We know that every dollar that is spent on these oral nutrition drinks or the nutrition kinds of interventions like the kind that Mend has developed, we've developed together with Mend, for every dollar you spend on those, you save $52 in hospital costs. And that's from a multi-million patient study that was published. And so the saddest part of it all is, of all the patients that come with malnutrition for these major operations, only 1 in 5, less than 20%, are getting these simple, straightforward interventions that A, are inexpensive, and B, are highly effective. And how effective are they? Well, we know, for instance, that if you treat a patient coming for a major GI surgery with a formula that contains some arginine in particular, and perhaps some fish oil in addition, along with some other protein content, you can reduce the risk of infection by 40% with just 5 days of treatment before the operation. 5 days. Not 5 weeks, not 5 months, 5 days. 40% reduction, and this is in thousands of patients studied. These studies are in good journals. They're in a wide group of patients. And this effect, this benefit actually doesn't depend on the patient being malnourished. This data is the same whether the patient's well-nourished or malnourished. So our bodies have evolved a mechanism by which when we get injured, whether it's a tiger that bites us or a surgeon that hits us, about 3 days after that surgery or that trauma, our immune cells begin to deplete arginine in our spleen and lymph nodes to keep our own immune system from attacking us and possibly injuring us further. But that's, of course, from many, many years ago, where if you didn't get up off the ground and start eating again after 3 days after the tiger bit you, you didn't live. Well, now, of course, after 3 days, we don't want your body to shut down your immune system, and we obviously want you to live more than 3 days. And so by giving back arginine, we can prevent this arginine depleting effect that all of us as humans have, and improve immune response to infection and prevent infections dramatically, like I said, by 40% with this simple intervention. And so just by giving arginine for 5 days before, or if, let's say, it's a surgery we don't have a lot of time to prepare for, like an emergent surgery, you can give the arginine and fish oil after the surgery and get the same benefit. So it works if you give it before and after, or just after. And so that's why this is one of the essential components of the Mend, Repair, and Recover product that we wanted to be sure was in the right amounts that have been studied, that could easily be administered and utilized by surgeons and patients to optimize their recovery. So I think that's one example of a simple nutrition intervention that any patient having major surgery, whether I was having it, whether you were having it, or your grandma was having it, or your son was having it, or daughter, anyone and everyone that's been studied, well-nourished or not, benefits. This is not a malnutrition-related effect. So all patients having major surgery should undergo it. I would never let anyone in my family have surgery without taking this. And when I have surgery, and I've had many of them, I always take these arginine-containing interventions before. And so I think that's one piece of this new Mend formula that I think is crucial, that has a great deal of evidence and really should be standard of care and needs to be educationally promoted more to our surgery and to our patients as well, so they know what to ask for. So I think what makes Repair and Recover a unique and exciting formula that I think our patients and our caregiving process desperately needed was that it's the first formula that really incorporates a range of the new science and evidence for the nutritional interventions that most benefit the preparation and recovery of our patients, both in how we prevent infection using arginine and fish oil, and how we correct vitamin D, which has been shown to reduce complications. If patients have low vitamin D coming into surgery, their complication risk is much higher. And so I think we're all beginning to believe that it's essential to replete vitamin D in our surgical patients. To the recovery components or the pre-op optimization components that we believe increase muscle mass, which we think is our key metabolic reserve for surgery, and allow for us to recover from the operation so we can walk again, so we can do the activities we want to do and live the life we want to lead. And that's where key nutrients like creatine. Creatine is one of the most widely and best studied of all the legal therapeutic nutrients you can take. 90% of high school athletes take it. It's been studied and shown safe when given for years to patients and people. It doesn't have any adverse effects on the kidney or any other organ. And we know it increases strength and increases the ability of muscle to do what our patients want to do, like get up out of a chair, walk down the street, walk up the stairs. Creatine improves the ability of people's muscles to do those basic activities as well as build strength in athletes. And so it does the things we want our patients to be able to do. There also seems to be some evidence it may have some benefits for the brain on cognition, and more research is being done there. But there's a wide variety of effects on many organs where creatine may have benefit. But I think in particular for the surgical patient, improving muscle mass before surgery, which we know improves outcomes, and recovering muscle strength and mass and function after surgery, which is always our goal for our patients to recover. And then the other nutrient that's really crucial here is HMB, or hydroxymethylbutyrate, which is another nutrient that is critical to muscle building and muscle recovery. It's an mTOR agonist that stimulates muscle to grow. There is a growing and large body of evidence for its benefits in the elderly and in young athletes as well, but especially in the elderly, improving their recovery, say, from hip fracture, improving their recovery from orthopedic surgery, improving the ability to heal wounds and be able to walk distances after injuries like hip fractures. It's been studied in many different surgical subtypes and had multiple studies that show benefit. And I think one of the most exciting studies was a study that showed that HMB has a big effect on the muscle we lose from bed rest. So for instance, if I lay a 21-year-old down in a bed for 28 days, they won't be able to walk. They will lose so much muscle mass. NASA did those experiments with astronauts. But if I take a 70-year-old and I lay them down in bed for just 10 days, they'll lose as much, 3 times more muscle mass than the 21-year-old that lay down for 28 days. And if I take a 70-year-old and I lay them down for 3 days, they'll lose as much muscle mass when they're sick as the 70-year-old did in 10 days when they're well. So just 3 days in a bed for a 70-year-old who has an illness or an injury is a massive insult to their muscle. And we've thought up until now there was no way to prevent that. Well, a really excellent study from Mick Deutz, who's the editor-in-chief of Clinical Nutrition, one of the most respected muscle physiology researchers with nutrition in the world, he showed you could virtually entirely reverse or prevent the loss of muscle from bed rest by giving HMB to elderly people who were laid in bed. And so that is enormously exciting for the potential of this nutrient being added to this formula. Because again, when someone has a major operation, an orthopedic operation, or say falls and fractures their hip or fractures some ribs, one of the major insults that leads to the end of their life is the muscle loss they experience, not just from the injury, but from laying in bed and not being mobile. And when we're 70 years old, those just 3 to 5 to 7 days in bed can lead to muscle loss that will never be recoverable and lead to the patient getting pneumonia or blood clots that will take their life. Hip fractures and other injuries and falls are a major cause of morbidity and death in elderly people. It's a common way, sadly, that so many of our elderly patients and elderly family members ultimately meet the end of their life, and it doesn't have to be that way. Interventions like HMB can prevent that muscle loss and allow that elderly person or our grandmothers or our grandfathers or our friends who, as they age, it allowed them to stay strong enough to get back out of bed, to do rehabilitation, to get their lives back and continue to have a meaningful life. And so I think what is truly unique about repair and recover is it takes all of these nutrients that for years after years now we've had exciting evidence that they change the outcome both in the short term and the long term for our surgical patients, and they've been put into one simple to use formula that anybody can use that is made of the highest quality ingredients. I think one of the things that really impressed me and really motivated me to want to collaborate and consult with men to build these formulas is these are the same nutrients that I take every day of my life. And again, I've had 27 surgeries, so I could have surgery tomorrow. I'm always at risk of going to the operating room. And when I looked at what you had in mind at Mend, and I thought, what are the things I take every day that I have to have 12 or 15 pill bottles and powder bottles in my house to take? This was an exciting chance to put all those into one thing so that the person off the street could say, where can I get all the things that have the science to help me recover best from surgery or help me prepare best for surgery, and where can I get it all in one place? I've spent a lifetime learning how to take all these different things I take every day, and then I encourage my patients to take. Now you can get it all in one place in a trusted set of ingredients that has the science, and we know will change the outcomes of our patients and have had the science for that for many years, and now you can get it all in one place. So I think another key opportunity we have to improve the outcome of patients having operations, having surgeries, is the role of carb load, the carb loading before the operation. And so we have robust evidence that if you give about 50 grams of maltodextrin, a complex carbohydrate, 2 hours before the operation as a clear liquid, you can reduce complications and length of stay significantly. In fact, you can reduce the length of stay of a patient having a major abdominal operation by 1.5 days. Again, these are little drinks or little drinks that cost a few dollars that could save days in the hospital and thousands of dollars in costs to the hospital and to the patient. And so just on that alone, this is an enormous effect. But it has to be done correctly. So all the studies that have been done to this point have used a certain amount of a complex carbohydrate called maltodextrin existing in the right concentration and the right osmolarity to be safe for someone to take 2 hours before surgery. Our anesthesia guidelines, I'm an anesthesiologist by training, say that you can take clear liquids up to 2 hours before surgery safely. And so we often hear people concerned about the carb load saying, oh, we don't want our patients drinking something 2 hours before surgery. But our guidelines that have existed since before I was a resident, so more than 20 years now, say it is entirely safe and reasonable to take a clear liquid up to 2 hours before an operation without worrying about aspiration when you send people off to sleep and induce them and have to put a breathing tube in. And so I think that's the first hurdle that we've had is I think anesthesiologists and surgeons have said, oh, I don't know about giving patients things to drink like that 2 hours before surgery, but our guidelines have always said that was safe. So that is not an issue, and that should never be thought of as an issue. But I think what is critical is this has to be done correctly. And unfortunately, what's happened with this new literature showing these exciting benefits that go beyond actually just the length of stay, people who take these carb loads also have less nausea and vomiting after surgery, less thirst, less pain. They feel better, they eat sooner, they go home sooner. There's lots of benefits to this. But what's happened, unfortunately, is people have said, well, why don't we just give them any kind of carbohydrate, sugar-containing drink before surgery? Why don't we give them Gatorade or a sports drink or orange juice, and wouldn't that be the same? Well, it's not the same. A, they haven't been studied, and so we don't know if they benefit the patient because the key of the maltodextrin is it was formulated that way because it induces reductions in insulin resistance when given that precise way. And we don't have any evidence that the other carbohydrate loading solutions have that same benefit or have any benefit. The other problems with the simple sugars of Gatorade and orange juice and other sports drinks is they don't empty the stomach the same way, and they could increase the risk of aspiration, right? All the research has been done with a complex carbohydrate maltodextrin, and all the research that shows it's safe to do, the patients don't aspirate, and they have better outcomes, have been done with only that specific carbohydrate mixture. If your patient or a patient was to aspirate and have a complication because they had Gatorade or orange juice, you couldn't really defend yourself because there's no evidence to say it's safe. We know that simple sugars and the osmolarity of those drinks is not the same and don't empty the stomach perhaps as successfully or as efficiently. And why would you use something that there's no evidence for and could create risk? I think the other key feature that needs to go into doing these correctly is these drinks need to be taken over about 5 to 10 minutes. They need to be taken in quickly, and so we have to instruct our patients to do that. They can't be sipped over hours. And then I think the other thing that has kind of begun to permeate into some of the commercially available carb load drinks is people have thought it was a good idea to add amino acids like arginine or citrulline or some of the other amino acids that may benefit surgical patients in other settings. The problem is we know amino acids, especially things like arginine and citrulline that generate nitric oxide, can delay gastric emptying. And so they can slow the stomach emptying. They could potentially lead to an increased risk of aspiration and complications for the patient. So again, none of us that have studied this literature for a long time or does research in this area would suggest using drinks that also contain amino acids as attractive an idea that may have been. And so I think what's important and unique about Carb Ready is it uses the carbohydrate content and concentration that exactly mimics the one that has been studied for years to be beneficial and safe. And I think that's what's critical. Anyone who's trained for a marathon knows that you don't go into a marathon or a major stress, which a marathon is, without carbohydrate loading the night before and the morning of. And that's how we suggest our patients do it. They should take 2 amounts of the carb load or 100 grams of the sugar, the complex carbohydrate, the night before surgery, before midnight, and then 1 carb load, carb ready drink the morning of surgery. just like someone running a race or a marathon would do. Again, the body doesn't do well, it doesn't tolerate stress well when it's fasted immediately before the stress. And that's what our fasting guidelines often make our patients do, but now we've overcome that through the safe use of these liquid carbohydrate loading drinks. But it's critical that the right concentration and right content, which is what Carb Ready delivers, is what's used, because that's the only thing we have evidence for safety and benefit from. And I think that's essential, and that's why this product is so important. It provides patients with exactly what has been studied and what they need in a simple to use formulation.